Hi, I'm Dr. Garza here at Alice Family Eye Center. Today I want to make a quick video just to talk about dry eye. We have a lot of patients with dry eye, and I just want to help some of those patients with dry eye to understand what that is. And if you need additional help and assistance with dry eye, please come and see us at Alice Family Eye Center. So first of all, we're going to start with dry eye and discussing the two types of dry eyes. So there are essentially two types of dry eyes. The first type of dry eye we refer to as productive dry eye. In productive dry eye, this lacrimal gland right here doesn't produce the water that your eyes need. So when we say productive, then this produces, right? So if somebody doesn't have enough of water coming out of the lacrimal gland, the eye is going to get dry. So we call that productive dry eye. That's where your tears are going to basically be coming from on the water component. So if there's not enough water, then we don't have enough tears coming into your eyes. And this is just a quick illustration to make the point that that's where the water from your tears comes from. Your tears are comprised of many different things, but the three basic things that they do have is a water, mucus, and an oil. So if one of those three components is lacking, your eyes are going to feel dry. So in productive dry eye, we see that a lot in diabetics. We see that a lot in people with rheumatoid arthritis or autoimmune disorders. So again, this is called productive dry eye. The other type of dry eye that we see a lot of is called evaporative dry eye. And along your lower eyelids, we have little oil glands that we refer to as the Meibomian glands. These little glands are located here along your lower lid, and then also they're on your upper lid. If you ever had a sty, then you've had an infection of the Meibomian glands. So these little glands produce oil. The purpose of the oil is to stabilize your tear film to prevent your tears from evaporating into the environment. So if you don't have enough of the oil, your eyes also get dry. The Meibomian glands go into the lid on the inside surface, and they produce the oil right inside there. So if the gland becomes clogged, I'm going to pretend like these are clogged oil glands here. If they stay plugged or clogged, then the oil gets trapped inside, and you don't get enough of the oil going in to your eye. And the oil is important for keeping your tears from evaporating. It forms a nice protective barrier for your eye as well. So lack of oil also means dry eye. In the pictures we have here below, we are going to show you some of the oil glands. So these are oil glands that you see here. That's the way they look in what we call meibography. Meibography is a way for us to look at your oil glands, and we do have a device like this in our office that helps us to do this. In this particular example, this patient is missing all of this here of the oil glands. There is this little sliver right here. You can see that in white. So, but for the most part, this gland is for the most part gone. In this case, we don't grade this as anything horrible because there is still a lot of Meibomian gland. This here, we can see that it's also thinning out right in this area. So our goal for this particular patient is to help these oil glands with warm compresses and other treatments in our office like Optolite. In this example here, we just kind of see the same picture, but it gives you a very clear understanding that there is a lack of oil gland. In this particular example here, we see that this person has a mostly full amount of oil glands here. We can see here there is a little bit of thinning, but for the most part, this is a mild case of dry eye that we can make better by treating these oil glands with warm or Optolite. In this example right here, we see that this particular patient, has lost most of their Meibomian glands. We see very little oil remaining in this area. Again, if I erase that, we can see this person has a very thin amount of oil coming from these glands. We want to avoid this. We want to avoid this. We want to avoid this, but we especially want to avoid this. So our goal is to have you come in so we can treat your dry eye, whether it's evaporative or productive. We can make your eye feel a little bit better. Come and see.